Hi, my name is Gabe Zadrali.
Hi, I'm Rachel Millard.
I'm Maddie Rogers, and we are O2 for you. Did you know that approximately every 30 seconds a leg is amputated, and 85% of those amputations are a result of a diabetic foot ulcer? About 25% of all diabetics will develop a foot ulcer at one point in their lives. That's 26.1 million people who have to undergo treatment. And diabetes is just one aspect of the global wound market. The global wound care market is a large segment valued at about $19.83 billion as of 2020. It has a compound annual growth rate of 4.1%. The subsegments we are focused on are advanced wound dressing and wound therapy devices.
So how do you treat a diabetic foot ulcer? One of the supplemental treatments is the use of hyperbaric oxygen therapy. This is a chamber that increases the air pressure up to 3 atmospheres while the patient lays inside, breathing in higher oxygen levels. This increased oxygen circulates through the blood and promotes quicker healing. HBOT, as it's often referred to, can also be used to treat a multitude of things. So what's the problem? HBOT is very expensive, with each use costing $250 to $500. Some people have to use HBOT 4 to 5 times a week, and they often have to go to a third party to undergo HBOT. That's a very expensive machine. They're only really found in hospitals and clinics. HBOT can only last 60 to 90 minutes per session, otherwise the increased pressure will cause lasting side effects. Problem? Meet solution. Localized wound oxygen delivery system.
So what is a localized wound oxygen delivery system? This is a unique hydrogel that internally generates oxygen through a chemical reaction, most commonly a peroxide reaction. The hydrogel will contain catalase to help break down the hydrogen peroxide into byproducts which will result in oxygen generation. This wound dressing can be applied nearly anywhere on the body since it's scalable from very small wounds to much larger wounds in the abdomen. It increases the oxygen levels on the wound to greater than 21%, creating hyperoxic conditions which help speed up the healing process. So what makes this hydrogel better than hyperbaric oxygen therapy? For starters, it's user-centered. It begins by being much cheaper than the current hyperbaric oxygen treatment, as it is only a small hydrogel bandage. The device was designed to be affordable and accessible, along with it being able to be implemented in negative pressure wound therapy. So what are the next steps for the team? Well, we plan on first finalizing our product architecture. We then plan to use our technical models in order to ensure that we're getting proper delivery of oxygen without any byproduct release. From here, we will then begin virtual prototyping and create our alpha prototype. If you have any further questions or would like to talk to us about our product, feel free to do so by using the contact information above.